My 34th book for the year. I'm getting there. Um, this book is in contention for one of the best books that I've read so far. Like all the books I've just randomly picked up. But if you are considering dying, you should consider reading this book. It's called 33 Meditations on Death. Notes from the Wrong End of Medicine by David Jarrett. Now, David Jarrett is a doctor for the NHS in England. He's a clinician, teacher, examiner, former medical manager. His extensive experience of frailty, death, and dying. He worked in Canada, India, Africa, and the USSR. He still lives in London. This book was published in 2020, and it's just so honest and so truthful and so wise in its approach to death. He discusses the death of his mother. He discusses the death of his father. He discusses what a good death is, what a bad death is, euthanasia, unnecessary care when you're old. He frequently discusses dementia, which I think is something that hits a lot of families and a lot of people a lot harder than they would expect. And my grandfather suffers from dementia now, and he's pretty far along. And reading a book like this, I think, will help you come to terms with the reality of what it is old people are experiencing and what it is we will need to experience as people who are dealing with those issues. I would have loved to have read excerpts from the whole book. There's a whole chapter that I would have loved to have read that it's called the modal death, or the most average death. There's a section about his mother's death and what her life was like. It's a whole chapter. I'm trying to find the. I'm trying to reduce the amount of reading I'm doing. Not that I'm a bad reader, although argument could be made. This is from the chapter called "The Changing Landscape of Care." A quarter of us can barely walk for 30 minutes once a week. 60% of adults have not done any sport in the last month. The most inactive are the poor, the long-term unemployed, and the never worked. Physical activity decreases the risk of dementia by 30%. Broken hips, 70%, depression, 30%, breast cancer, 20%, bowel cancer, 30%, diabetes, 40%, vascular disease, 35%, and overall mortality, 30%. Only a quarter of us can manage 5 portions of fruit and veg a day. Yet even if there was a social revolution tomorrow in the way we eat and exercise, we would only be postponing the need for care. One of our young cardiologists calculated that in Portsmouth in 20 years, we will need another 1,000-bed hospital, and it will be full. Something has to give. I spent a lot of time discussing unnecessary treatments and life extensions, which is something I think that a lot of people should really consider before they end up going to hospital. So he discusses DNRs and these sorts of things. This is from Dying a la Mode, so the average death. Death takes its own time and won't be hurried by other people's timetables. Death does not care about or acknowledge your daughter's need to attend the Oscars to collect a Lifetime Achievement Award or your grandson's wedding at the weekend. Death is selfish in that way. Bit by bit, the candle burns out. Your breathing becomes shallower. You are soon to take your last breath. Those who love you want to be with you in your final moment, but it doesn't always work out that way. With uncanny frequency, a relative who has attended day and night for days dips out for 5 minutes to go to the toilet or to get a sandwich and misses your last breath. Sometimes it seems that the dying can feel physical presence of the living and hang on while they are close. I always advise families to expect this strange phenomenon and not to feel guilty if it ever happens. And then you have taken your last breath. Over the next minute or so, the brainstem may send signals to the chest, and a few gasping attempts at inhaling may occur. A few minutes later, your heart, deprived of oxygen, stops for the first time since it started when you were a 6-week-old embryo. Some vomit or frothy pulmonary edema, pink and bloodstain, may appear from your mouth. There may be a popping sound as some diarrhea trickles from your anus. This is the end of your life. It's pretty brutal, but I think people should take the time to read these books, as it will help you later on in life, and it will help you deal with some of the life problems that you may have. But without a doubt, this has been one of the best books that I've read this year so far. Check it out.